a healthy new you with Kayani. So, my dear friends, we promise another exciting evening with a very special guest, of course. But before I introduce her, as always, I'd like to know which part of the country and what you have to do when you hear the music. Type in the box now.
Celebrate good times, come on. Let's celebrate. There's a party going on right here. A celebration to last throughout the years. So bring your good times and your laughter too. We gon' celebrate your party with you. Come on now. Celebration. Let's
Okay. Ang dami, no? I saw somebody watching from USA. I'd like to invite Miss Leslie, our operations manager, to read out where our guests coming from, Miss Les.
Hi and good evening, everyone. Actually, in the opening pa lang and the video, people were already typing where they're coming from. So we have Proceso Galvan from Davao, Gina and Jessel Gallego, Team Gallego daw sila from Digos, Cheska Balayo from Iloilo, our Suki, Hana Hiron from Pasig, Nerissa Suberer, Diamond from CDO, Nanette Corpus from Davao Occidental, and let me see, there's so many more. Jason Blake Janeo from Davao City, sabi niya, he misses the the Healthy Living webinars. Oh, so welcome back. And we have Maria Neri Bergonia from San Mateo, Randy Serrano from the Philippines, Eric and Kathy Kirong, our diamonds from Lipa City, Maricel Panganiban from Pasig City, Christian De Vera, kamusta ka na? From Isabela, Lourdes Ragudo from Bacolod City, Annalisa Jagmis from Taytay, Palawan. Taytay ha, Palawan. Josephine Rengil from Digos, Ferdinand Rivera from Bulacan, Zainab Magbanwa from Iloilo City, Gerald Mendoza, he's in Davao now, Elma Kabay from Caloocan, Nilo Neil from Bulacan, our other diamond from CDO, Rich Molina, Bernadette Ople from Bulacan, Presi Kapitan from CDO. Oh, we have somebody from Malaysia, Fuziana. Welcome. From Aklan, Lalaine Regno, sorry. We have from Cavite, Anas Pali Cavite. Teacher Nati, from Martin, good evening. Emilian Bangkisho from Davao, nako, and the list goes on and on and on.
Yeah.
Welcome,
Actually,
everybody.
when people were typing in their locations, no, I already saw somebody from US, from Saudi
Malaysia.
Arabia, and another one, yeah, Malaysia and Singapore. So welcome to all of you, and thank you, Miss Leslie, for helping us with that roll call of our very special guests tonight. I would like to welcome all the top leaders of Kayani Philippines and their teams. You know, we have a lot of diamonds who are here with us. Thank you for bringing your entire teams and guests here. And a warm welcome also to our healthy living experts, if there are doctors out there, to all our family and friends. Salamat po na nandito kayong lahat. A very warm welcome if there is anybody here who is joining us for the first time. Now, as I said earlier, we will have another exciting conversation tonight, no? And the topic is a healthy new you with Kayani. Alam naman natin pagka New Year, we always resolve to make new promises, to do these new habits, etc., to kickstart the year. Our special guest tonight has been practicing medicine for the last 31 years. She's based in Navotas, where she has her own clinic, the Torreja Medical Clinic. And I'm happy to share with all of you, kung may mga taga Malabon, she just opened a new clinic in Malabon. She is founder and attending physician of the Navotas Diabetic Association since 2000. She graduated Doctor of Medicine at Our Lady of Fatima University in 1988. So very young pa ang ating doctor, no? She's a former faculty member of the St. Rita College of Nursing, and she has done extensive research and studies on alternative medicine, which I find very interesting. Ladies and gentlemen, let's go to the chat box and fill it with a lot of hearts and sparkles and claps for our special guest, Dr. Teresa Torreja. Good evening, Dr. Teresa.
Hello, mabuhay. Welcome to all of you, wherever you are, mabuhay. And we have a blessed day tonight with Mommy Kate, of course. Thank you for having here.
Of course, we are honored, Doctora, to have you, no? Kasi I've heard you speak in person, and you are so full of life and excitement and energy, and talagang yung puso mo overflowing with love for your patients, no? And of course for Kayani. Alam ko, Doctora, you know that in our conversation earlier that a patient was the one who actually introduced these products to you. Hindi po ba? Tama ba,
Yes,
Doctora?
Mommy Kate, yes.
Oo. And then, you try the products and then sabi nyo, something wonderful happened. Siguro po, kwento natin yung ating before Kayani and after Kayani experience, no?
Yeah.
Doctora?
Thank
Okay.
you for that, Mommy Kate. Before Kayani, I am a diabetic. I'm hypertensive, having rheumatoid arthritis together with degenerative osteoarthritis, which all runs in the family.
Ang dami,
Yeah.
And then, Doctora, it's so nice to see na very human ang ating mga doctors na nagkakasakit din po kayo. Oh, and then, ano nangyari? Oo.
Yes, after taking Kayani, tried to take this Kayani together with my maintenance, of course.
Yes.
And I saw the remarkable improvement day by day. And I see myself now improved a lot and improved my blood sugar level, my blood pressure, and even I can walk straight. Yeah, of course, together with our maintenance, discipline, and good eating habits.
O yun. So makikita natin dito, no, na si Doktora, kinombine niya. Di ba, Doktora? You combine the Kayani products with the medications you were taking. And then you saw a remarkable improvement, like your blood sugar levels came down to the normal range. Mahalaga yun kasi how hard was it before Kayani, Doc?
Would you believe I reached the 500 milligram per deciliter? I was shocked then.
Really? What is the normal range, Doctora?
Normal range runs only, you should have up to 120 milligram per deciliter.
Oh my gosh, so that's
Yeah.
very high na.
Very
And
high, really very high.
What were you feeling already at that point?
I'm already thirsting. I just noticed while managing my patient, attending to my patients, I always go to CR to urinate or to make a wee, and then I drink a lot of water, and then decrease my weight, and then I just say that I am not a diabetic person because I was spared in the family of having diabetes. But since I keeps a lot of eating mixed nuts and chocolate with nuts, I love those food.
So you have to watch our diet, no? What's the
Yeah.
one that caused it pala? Okay.
Yes.
All right.
Uh,
So, malaking bagay na naipababa yun, ano?
Yes, Mommy Kate. And I was very happy because together with the Kayani products and I had my insulin shot, and immediately I saw remarkable improvement with my blood sugar level. And then when I reached the normal level, I immediately discontinue my insulin shot because it's already normal to be sure.
Okay, so now that Doctora is starting to share about her condition, no, I just want to invite Miss Leslie to go back on to read this disclaimer kasi we always say, Doktora, that Kayani products are not medication. Les, tulong naman.
Okay, so just a reminder, Kayani products are not medication and are not intended to diagnose, treat, cure, or prevent any disease or medical condition. The following slides may not be used in whole or in part and may not be posted on social media without permission from Kayani Philippines Incorporated. But let's go on with the very exciting story of Doctora Teresa.
Okay, Doktora Teresa, we will continue our conversation. So, nag-umpisa ka nang mag-take ng Kayani, all right? And then, I know that at a certain point, you said, to food supplements, to nutritional supplementation. Doktora, in your opinion, bakit mahalaga to take foods this day and age? Kasi others will say, I eat naman a lot of vegetables. I take naman a lot of fruits, no? But why do we need to take food supplements,
Thank you
Doc?
for that question, Mami Kate. It is very important to partner this supplementation in our food, in our maintenance. It is because it helps a lot in improving our body's normal system to go back to what is lacking, to put or to replace all the all the actions of our body to fight any illnesses that comes to our lives. So we have to put this supplementation in order to fight, in order to help fight our enemy, our illnesses that progress or keeps from having more complications. We have to give more priorities of what we are taking, and these supplementations is the best thing that we should choose of rather than any other from the market, that we cannot assure that this food that we are eating will cause too much damage to our
Okay,
system.
thank you. So in essence, Doktora, is ang nag-gather ko doon is yung food supplements can really help beef up kung ano yung kulang sa ating katawan, di ba? Yung to for example, like ngayon, no, alam natin naman that the soil kung saan tayo nagtatanim is not as rich as it was many years ago. Ngayon, there's a lot of pollutants like the chemical fertilizers, etc., etc. So yes, I agree with you, Doktora. And then when you started to share the Kayani products to your patients, no, can you give us like an example of a patient who was helped by the products?
Like for example, one of these patients, we start with the children.
Oh,
We
children,
start with the
sige.
children.
Oh, because I'm sure many parents are watching eh. Oh.
Can we start with the children and then I'll go with the elderly? With the children, I noticed one patient with the ADHD. Could I mention that, Mami Kite? ADHD. And that ADHD is very active. They cannot focus to you in one question. I have one patient. She's 8-year-old, and she's always going to my clinic and ransack my whole
Touching
clinic
everything.
because she's touching everything, going one place to another, and she goes to me and asks too much question. If you will not answer the question, she will touch your face and everything. So you know that this illness have to pay attention, and you have to be considerate, or you have to take care of these children. So what I did is to give the Kayani products to this child, and good enough, together with the counseling and mother's advice, this child improves a lot. And one time when this child and the mother visited the clinic, she's very disciplined. She's very behave in one seat only. And the mother approached me and said, "Do you know that my child, this girl, is after taking Kayani together with this advice that you gave us, improves a lot. And I was shocked because I didn't know that that was the girl that we are afraid of when they are visiting my clinic.
Kasi
Yeah.
magulo, parang
Magulo.
tornado. Oh, yeah,
Oh,
yeah.
yes, yes,
Yes,
really.
oh,
Up to the
yeah.
extent that I advise my secretary, "Oh, the child is already there. You have to keep the things that might be broken. So that is
But this time, she was just sitting in one corner.
one
Behave,
corner.
huh? Wow, that's amazing,
Yes,
Doc.
yes, yes.
Children who are like autistic, have you helped? Do you have patients who are like that? Na
Yes,
autistic sila, tapos natulong. Kasi di ba yung autistic, mas mahirap yun eh. Parang um, they cannot respond, they cannot look at you
mm,
when you're talking to them. Yeah.
I should say it is much like an opposite of the ADHD because
Oh.
this autistic patient that I have, I referred that to a pediatric neurologist, and then they are coming to me because I also gave the Kayani products together with the management of the pediatric neurologist. And
Mm.
then she told me that this patient before she cannot focus to me, eye to eye contact. She cannot respond immediately to my questions. And but surprisingly, the mother told me that she improves a lot than the other patient in the room where they are having the therapy. So that's very important thing to the patients having autism. So
Yeah.
we could also give the Kayani products to these children.
I have a friend, his name is Armin Demetilio. In fact, he loves our products no, because it actually helped him with his own depression. Like you said, does not look at
Yes.
you when you talk to them, does not speak. Now this
Mm.
child is performed very well and enrolled her in a mainstream school like Poveda and is now so
Right.
talagang mahal na mahal niya yung bata niya. Of course, mahal na mahal rin niya ang Kayani because of what Kayani has done for the child, no? Doktora, I'm just
Mhm.
curious to know, out of all our products, ano bang paborito mo? What's your favorite?
Mommy Kate, I love sunset.
Talaga? Why the
Yeah.
sunset?
It is because it gives me a really they are telling me sleep like a baby. It's true because whatever time I have before going to bed, like for example, I go to sleep late at night after my busy schedule, after all the things that I've done in the whole day. When I when I take Kayami sunset, the following morning, I just a good morning. Yeah, really a good morning. No, no hangover, no muscle pain. Just a really as if you are really normal. It is really, really very good feeling in the morning. I love
Yeah.
really sunset.
I also shared that same experience, Doc. You know, I love the sunset because no matter how late I sleep the night before,
Yeah,
and
yeah.
if I need to wake up early, I
Mm-mm.
it's as if I really came from very deep, restful sleep, and
Yeah.
I wake up and I hit the ground running, hindi foggy yung brain. Di ba? Ganon,
Yeah,
doktora.
yeah.
Sharp pa
That's
rin, no? So,
sharp pa rin.
oo, that's why pareho tayo ng favorite. I also love the sunset. Okay, Doctora, you talked about a patient who came to you who had difficulty breathing,
Mm-mm.
no? And then binigyan mo ng nitro. Ano nang nangyari dun sa pasyente na yon? Can you share more about that one?
That was the time when we have no my nebulizer is out of order, and then
Mm.
they came to me, all the relatives came to me because it's an emergency. What I have to do is to give anything to ease the patient from difficulty breathing. I gave nitro F concentrate, no need juice, and then every minute I gave initially every minute for 5 doses, and then followed by giving another after every 30 minutes. Then the patient improves a lot. Of course,
Mhm.
I gave also the bronchodilators, the oral bronchodilators that really helps together with the Kayani NitroFX.
Wonderful. So here we can see a doctor who is boldly combining the medications that she would normally give together with the Kayani products, no, and seeing remarkable results for the patients. How about I would just like to invite everyone to please type in your questions. There is a Q&A portion here. Can you please type your questions so that we can ask Doctora your questions later. All right. So, how about people who are suffering from cancer, Doctora? Meron ka bang pasyente? Do you have patients with cancer that you have helped?
Yes, Mami Kate, I'm doing a lot of observation and research regarding these things using the alternative products, the organic products like the Kayani, together with the management of the specialists like the oncologist. These patients are coming to me for the palliative medications right after chemotherapy, especially during those times that the patient having many signs and symptoms of the after effect, the side effect of the chemotherapy medications. And then they are experiencing very good result because the nausea and vomiting, which is very prominent, which is very common among these cancer patients, they are not experiencing any of these signs and symptoms like weakness and they cannot eat. But these patients start taking these Kayani products, they can eat immediately after, right after the chemotherapy, and they can go back to work. These patients are really thankful for having those feelings after the chemotherapy.
Yeah,
Before, it is not.
it's not. Yeah, because I know that for patients who are undergoing chemo, they become very weak. Di ba, Doctora? They get weak. And so in your experience, somehow they have more energy, di ba? They're able to be functional. Mahalaga kasi na hindi ka lang bedridden di ba? Mahalaga that you are able to do your work, you're able to socialize and be with people, no? And while we cannot say that that these products, our products, can cure cancer, but it has improved the quality of life of cancer patients. No, I'm just going over the messages here in the chat box. Sabi ho ng Diamond Marcel and James Soriano, amazing, no? Yung mga kwento ni Doctora, even Lorna and Hannah Joy. And then, of course, we have May, Josephine, Giselle, Lorna, again, Nerissa Subere. They all agree with you that they love sunset. Okay. Doctora, there is somebody here who has kidney stones, no? And wow, she says here 1.2 cm and the doctor advised me to undergo operation. Sa awa ng Diyos, magaan ko ang pakiramdam ko when I took the Kayani within 2 weeks. That's nice to hear, no? Kasi talaga namang the well-being improves diba, Doctora, when we take our products.
Yes,
Yeah.
Mommy Kate.
Oh. You see like how many patients every day, Doc?
Average is 20 to 25 per day.
Yeah.
20
Okay.
to 25 patients per day.
Yeah, and majority of them you have introduced Kayani products to.
All of them, Mommy Kate.
Oh, really? All
All
of
of
them
them.
take it. And what is their reaction, Doc? What is are they open to it? Kasi, syempre, si Doktora ang nagrekomenda no? So,
Yes. Yeah, Mommy Kate, in 31 years in practice, my clinic is already an institution here in Bangus Street. When
wow.
when the doctor prescribes, so you have to take this because you will get well. And they initially some are apprehended and they said, "What is that, doctora, for? Isn't it that it is only supplement? So it is not my medicine. Can do I skip this? And because I don't only have such money, I cannot afford that. when I said to them, okay, it's up to you because that's only your money, but excuse me, since I am a doctor, you came to me, you have to follow instruction in order to get well. But there are times that this patient, I allow them their choices. And
Okay.
then when they come up to me, and that's it.
Yeah.
So that's what I told you. It really it lengthened the management in order to shorten the course of management. So the more expenses that you will have. And now they knew me. When you come to Doctora Torreja, you have to follow the instruction. That's very important to me.
Okay. Doctora, we have a lot of questions here about autistic children, ano, and ADHD. Yung sa 8-year-old mong ADHD, and 8 na pasyente, what did you give?
I
You gave
give
all?
sunrise all I give all because
Oo.
I'm giving the sunrise because it's very good anti-inflammatory, and this helps the children to fight neuroinflammation also, and also especially the sunset, since it is fat soluble, and our brain is composed of 60% fat. The more it will diffuse properly, and they will help the neuroinflammation as well. And also the nitro, it will open up and dilate the blood vessels in order to improve the circulation. So this all
Doctora.
helps. Yes.
Yeah. Your screen is getting blurred, no? Maybe
Yes.
i-off mo muna yung video niya, Lance. And then, is there anybody else in your house using the internet? Baka pwedeng ikaw
Close
lang muna.
Yes.
Oo.
Close naman.
Ikaw lang muna kasi nag-aagawan kayo ng ano.
Okay.
Oo. So, kasi nawawala
Next
po
muna.
kayo.
Ay,
Oo.
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 Okay.
Okay. So, babalik na tayo
Okay.
kay Doktora. Can we turn her video back on? Okay. So, yung binigay po ninyong, Doktora is talking about the triangle of health for people who are listening to us for the first time tonight, no? And the triangle of health, as we can see here from the photo that Lance is flashing on screen, is composed of the sunrise, the sunset, and the nitro. Actually, lahat po ito binigay ni Doktora dun sa kanyang pasyente na 8-year-old with ADHD. Doktora, tinatanong po no, they're asking how much, kasi if you can see in the photo, isang pouch yung sunrise.
Mhm.
The 8-year-old take all of that or half of it? How much?
Half of it.
Half of it.
Yeah.
And then, for the, kasi the adult dose naman of the sunset is 3 capsules, 3 caplets. For the little child, ilan po?
One capsule. One capsule at night, at bedtime.
At bedtime. And then, yung nitro natin, how much did you give? Isang patak? Paano?
10 drops. 10 drops.
10 drops of the little bottle.
Nitro FX only. The
Oo, Nitro FX. The small bottle lang ha when she talks
Of
about the
course.
10 drops. Not this big dropper.
Not
Itong
this
big dropper na to is for the adults eh.
The
So
adults.
10 drops of the small one. Okay. So that question has been answered. Regarding the autistic child, how long did it take for your patient to have good results, Doktora?
1 month.
1 month.
Took
Yes.
1 month.
Yeah. It took my friend also about the same time, about 1 month. All right. And then Benita is asking, pwede bang isa lang ang inumin? Pwede bang kung gusto ko sunset lang, sunset lang. Anong sagot dyan, Doc?
Because as we have said, triangle of health. When you
Correct.
say triangle, it is a synergistic effect. If you want
Yes.
the best effect in it, you should take the prescription or the instruction of the doctor.
Right, right. Okay, so Doctora is saying that if you want the optimal effect, the synergistic effect of all the products, kasi each product is strong on its own. Diba, Doctora? I always say
Yeah,
that
yeah.
eh. But if you combine the three, amazing po ang results, no? We have Julianita Talatu. She's asking, Doc, there's a leukemia patient who is suffering from pain severely. Do we have a product that can help?
from suffering from pain, as what I have said, you have to consult to the doctor
Yes.
who will give more prescription or more the best option for these patients, because it is better to consult the doctor regarding this matter
Yeah.
in order to achieve the optimum result. But I do suggest that combine it with the Kayani. Number one for that pain is the Nitro FX. I do
All right.
observe when my husband got pain in his feet, because he's diabetic also, with that with neuropathic pain. He just took the Kayani big bottle for dropper every 30 minutes, and after 5 doses, it's gone. It's really
Okay.
gone.
So, since you are a leukemia patient, the suggestion of this doctora is go back to your doctor who will help you manage your pain. But if she were to recommend, she would recommend the Kayani Nitro FX. All right, for the pain. All right. Then we have, will somebody suffering from rheumatoid arthritis and gout be helped by our Kayani products?
Yeah, I love that. It is because I experienced the same thing before,
Okay.
Kayani.
Lance, can we just focus on Doctora so we can see her closer? Okay, there you go.
Yeah, it helps a lot because you have to
Nawawala siya.
wala, yeah.
Oo, okay.
Okay,
Okay, let's go back to the small picture of
small
Doctora.
picture. I'm sorry. For
Okay, all right. Okay.
Okay, I'm sorry for that. So,
So rheumatoid arthritis,
rheumatoid
doc, that's the
arthritis.
question, yes.
Yeah, rheumatoid arthritis, gout arthritis. If you have gout arthritis, you have to take medicine for gout during attack. Combined with our Kayani products. Why combined with the Kayani products when there is an illness? It is because it helps a lot to shorten the course, to enhance the effect of the medicine, and in order for the patient to recover fast recovery. The sunrise, the sunset, and the nitro will help a lot. Will help a lot. The sunrise, you have to take the sunrise. I experience as 2 sachets of sunrise 2 times a day, together with the analgesic or any anti-rheumatoid agent. But you have to be cautious if you have kidney failure or kidney problem. You have to shy away from taking NSAID or non-steroidal anti-inflammatory drugs. And there are other drugs that will not affect your kidney. Because if I will say, together with the anti-rheumatic arthritic drug, you will get another one. As cautiously, some other patients will buy anything uh, in, uh, in the counter or in other drugstore, and other drugstore are not so particular with the patient's concern, sad to say. So this patient will take that for a long period of time, and the kidney will be affected, and having chronic kidney disease secondary taking anti-rheumatic drugs. And my father is one of the victims that during his life. And as I have said, cautiously, or as a warning for everyone, if you will take anti-rheumatic drug together with the Kayani products, it's best for us to partner this, because you will not need. Do you know that I only giving the anti-rheumatic drug for only 3 days, 4 days, together with the Kayani products? But if you will take this only the medicine, the synthetic medicine, it takes a long time for you to recover, to get off from pain. But together with the Kayani products, it is in a short period of time you will get a better result.
Okay, thank you, Doctora. So what I gathered from your reply was when you combined the Kayani products with the medication for your rheumatoid arthritis, kasi you were suffering from this, right? You mentioned this early on. Oo, parang na-compress, shorten the time for healing and recovery. Okay, there's a question here. This is from Ola Otse Gabasiane. I don't know if you are a foreigner, but sabi niya, thank you for this very important forum. My question is, I have two nieces who have been on psychiatric medicine for over 10 years. Okay?
Mhm.
They are taking Kayani. Should they continue with their psychiatric medicine? I think so if it's prescribed, di ba, Doc? What do you think?
Yes, yes,
Yes,
yes, yes,
yes.
yes. You
Okay.
should continue until the patient gets better, and
Yes.
the doctor, really, the doctor is the one who will discontinue. Like for example, I have an experience to share, just a short one, Mommy Kate.
Yes. Yes, please.
The patient is having suffering from severe rheumatoid arthritis with deformities, and then the doctor managed him for a year already, and then suddenly when taking the Kayani products without knowing the doctor that he's taking the products, he improves a lot, and the doctor really stopped other medication. He's the one really up to
Yeah.
stop the medication, and then
Wonderful.
you should continue the Kayani triangle approach.
Yes. So what Doctora is saying to Olaotse is, they should continue taking their medications.
Yes.
And when the doctor, together with the Kayani, all right,
Mhm.
when the doctor sees an improvement in the patient, he will be the one to tell the patient, okay, you can stop taking the medication already. And then the
Right.
patient just continues with the Kayani. Nice.
Kayani.
Okay. All right. Doc, naku, so many questions coming in now. We have Henry Pernada. I have 15-month-old twin girls, and they are very healthy. I want to know what Kayani products can you give this? This is a little over 1 year old, no? Can you recommend for brain development and immune system support, Doctora, for 1 year old and above? Pwede na ba
Wow.
magkayani yan? Can they take
Yes.
Kayani?
Do you know, Mami Kate, that I have Kayani babies already? 2 Kayani babies. When you say Kayani babies, the mother, while the baby inside the womb of the mother is taking Kayani products already.
Yes.
And then
Yeah.
until the baby delivered, the baby when got some common colds, I asked the mother to put some Nitro FX 1 drop every day, 1 drop, and then inside the nostril of the baby, and then after 1 day, 2 days, the baby improves.
Wow. Wow.
It's
I
really
hope the
amazing.
mothers are listening very well to what Doctora is telling you right now.
Yes.
Okay.
Even my first apo, Mami Kate, I have first apo.
So let's say if they're not sick, Doctora, do you give them the nitro? Do you give them the sunrise? What do you give them if they're not sick? Just for overall maintenance of good health.
if
The
you are
baby.
not sick, if
If
you are
the
not sick,
babies, kung walang
the
sakit yung
babies.
mga baby. Oo.
Nitro FX only once a day, 1 drop a day will do.
Okay.
Inside
All right.
mouth.
So I hope that is the response to the question of this ano na ba? Dami, natauban na yung mga tanong ko. Nawala na sila. Okay. All right. Now, all right. Oh, Doctora. Maria Adoracion Tabo-Tabo is asking, good evening. I'll just translate the question, no? Can we use the Nitro FX in our eyes if we have pterygium? Have you any case of that, Doctora?
Yes, Mami Kate. But again, you have to consult with the ophthalmologist.
Yes.
It
Yes,
is
I
always
figured
a
that.
warning. It is always a warning for us, especially our eyes is so sensitive, and we have to be careful with this. If there is a pterygium, there are kind of pterygium. There are kind of pterygium that is already covering our iris, and that is very important for you to see the ophthalmologist. And there are pterygiums that are just starting. That is our Kayani Nitro FX is very good for that. Just starting like some kind of blood vessels at the lateral part of the eyes.
Yeah.
Yes, so you have to give Nitro FX 1 drop 3 times a day. 1 drop 3 times a day will do, and soon after 2 weeks or a month, one patient after a month, this improves. In the
Yeah.
beginning, the beginning one.
Okay, so if this is just a starting condition,
Starting
but
condition.
again, Adoracion, Doctora said, because you have your own doctor, talk to your doctor first and share with your doctor our nitro products. He will be the one to decide, di ba? Parang we have to be safe in that way.
Yeah, that's to be safe.
Okay. Let me see. We have more questions here. Wait, huh? Oh, this is from somebody who did not give his or her name. My daughter is in the hospital right now. She has dengue, doc.
Mhm.
What dosage of nitro and sunrise should I give her? She's 2 years old. Can we help this child, Doctora? What do you think?
Yes, 2 years old. As long as the patient, as long as the child can swallow, can eat fruits and vegetables, the more we will give sunrise. 1 teaspoon 3 times or 2 times a day will do. And then the Nitro FX 2 drops or 3 drops 3 times a day will be enough for them. And then together with the hydration and the management of your doctor.
Yes. So idadagdag lang. You would just
Dadagdagan.
add what Doctora said.
Yeah.
Very good. We have Proceso who's asking. I have somebody who has ovary, breast, cyst. Can the Arcayani products help this person?
Yes. Again and again, go to your doctor. See if it is because some of the breast mass and together with the ovary, some are cancerous or some are should be managed surgically. But again, during the process of management of these doctors, you can partner because this will give more energy and the more time for your giving time for your body to fight the illness. And I experienced that some of my patients improves remarkably, and the size of the mass decreased a lot.
Okay.
It helps a lot.
All right. What about somebody who is having dialysis? Can they can they still be helped by our products, Doc?
Yes, Mommy Kate.
Do you have patients like
Yes,
this?
my brother-in-law in Bulacan. He is having dialysis 3 times a week during
Yes.
the pandemic time lockdown, and he has to go to the hospital for his dialysis session, but he cannot find any transport because it's lockdown in the and when he saw and remembered the Kayani one bag that I left in a room, he immediately took the Kayani products and he improves a lot.
Mm.
Before he consumed two tanks, big tanks of oxygen every day. But when we visited him, it's already gone. He's not consuming or out of oxygen support, and
Yeah.
the frequency of dialysis is only once a week. So it's amazing. And some of my patients have an elevated creatinine as early as 200 up to 200. It runs down to normal. Of course, together with the synthetic medicine again and again.
Okay. Yeah. So, you're already asking, Doctora, I'm looking at the questions that are being posted now about specific conditions, And
Mhm.
so, the guideline here, as Doctora always says, is go back to your doctor
Mm-mm.
and tell explain to your doctor what you're experiencing. Your doctor will be the one
Mhm.
to prescribe the medication. And
Mhm.
then just tell your doctor, I plan to add the Kayani, and then let's see
Mhm.
what he will say. All right?
Mhm.
Para we are all safe. All right. We have here, for this anonymous attendee who's asking about complete healing. Again, here in Kayani, we do not guarantee cures. Okay? We do not guarantee cures. What we just say is we give the Kayani products are able to, give the nutrients that your body needs
Needs.
so that it is your body that heals itself. Okay?
Mhm.
Doc, this is from Sarah. My
Mhm.
wife experienced bleeding even if she does not have her menstruation. We found out later during checkup that her mattress, what is mattress? Was thick. Uterus has
Yeah.
thickened. Will Kayani help her? Will it stop the bleeding? Again, cure na ito, Doc. So, what is your response to this, no?
So first, I should give her a like to stop the medicine that will stop the bleeding, and then the Kyani product,
Yeah.
because the one who is bleeding loses a lot of energy, loses a lot of hemoglobin. So you have to give this highly nutritive products. The our Kyani products will really give enough energy for her to support the body, and later this will go to your uterus, to her uterus, to improve the condition, of course together with the management of the doctor. So she has to see the doctor, and
Right.
together with the
Right,
product.
because Doctora said, you go to your doctor, the doctor will prescribe you a medication to stop the bleeding.
Mhm.
And then, but if it was Doctora, she will recommend that you combine the Kayani product with the medication she will give. All right, Doctora, somebody here said, Yolanda Asuncion, Doc, I do not have a doctor yet. Can you give me your cell phone number and office address? Yes, we're going to flash that
Okay.
later, no? For those of you who want to consult Doctora. Katrina Nickdow, she said that we are recommending lower doses for children, Doc, correct? No?
Yeah.
How about for older people, like 75 years old? So do we also lessen the dose? Kasi matanda na sila. What do you think?
Mami Kate, you have to triple to quadruple the dose. Why?
Older.
Yeah,
Really?
yeah, because
Ah,
based on the study, as we advance our age, when you reach 50, when you reach 60, at 50 you have only 35% production of nitric oxide, which is responsible for the dilatation of our blood vessels. When you reach 60-year-old and above, only 15%. And where you're gonna get the 85, the remaining 85 losses of nitric oxide that
mm,
will support your blood vessels. This will further thicken your blood vessels. And if thicken your blood vessels, there is a poor circulation of the nutrients and oxygen that your parts of the body needed. So your body cannot fight the illnesses. They cannot increase their immune system. So you have to have more. What I always telling in my webinars or in my
yeah.
lectures, if there is a severe case, if there is a lot of enemy, if there is a lot of basura or garbage, you have to double your panlinis, your cleaning materials. You have to double your soldiers. Same with the Kayani products, you have to double the dose. As much as you have to the small bottle, you have to half of it 3 times a day,
Wow.
because
Wow.
our
Yeah.
elderly needs this much,
Yeah.
because all our Kayani products really support or encourage the production of more nitric oxide in our body than
Yeah.
anything else. Yes.
Yeah. Thank you so much for clarifying that, Doc. No? And that's also a wake-up call for Mommy Kate because I'm 65 years old. So it's okay to take the sunrise 2 or 3 times. Diba? Yung pouch, Doc, okay yun kay
Yes.
Mommy Kate. Tapos,
Yes.
can I take 6 or 9 of the sunset? Because I take 6. Should I
Yes.
add pa?
Yes.
Doktora?
One of the prominent woman in our country is taking 999, and she looks younger and energetic. 999, imagine that.
9 of the sunset,
Nine of the sunset, nine three
three
times a
times
day.
a day.
Yeah.
Oh my
Mm.
gosh, really, really. I will not ask you anymore kung sino yung famous lady na yon, no? But so I
Yeah.
can take 9. I can
Yes.
take 9, yeah.
Yes.
And Doctora, I was having like chest pains like 2 days already, no? And I took 1 bottle a day of this.
Oh,
And it's
wow.
helping me feel better. I finished 1 whole bottle yesterday and another whole bottle today. It's helping me feel better. So, tama si Doktora, kapag talaga you have to increase the dose, no? Okay, there's a question here from let's look at those who are not saying anonymous. Mary Chris Asor. How about enlargement of the heart, doc? She's presently suffering from edema, and my abdomen is very hard. That's why she has a hard time breathing. What can what can you advise for her, doc?
Ah, so it is really a problematic one. Uh, I could ask her or him if the doctor is already there, or if she has already a doctor who manage him or her. If
Mm,
she's being managed, uh, you could take the Kiani products along with this management little by little.
okay.
Because if you have edema, your heart can no longer hold large amount of volume in your body.
What is
Because
edema? Manas? Is that
manas, yeah, manas
yeah, and that happens where in the legs?
in the legs, and then going up to the stomach, because there is
Oh,
grade 1, grade 2, and grade 3, and generalized edema. And
wow.
it happens, if it is happens, you will feel difficult of breathing and easy fatigability, and you cannot walk in a distance. You will feel really difficulty of breathing, and you have to be the doctor should be discover what is the secondary effect of this, or what is the primary reason why you are having that. There are so many reasons of why you got this sickness or illness, why you got this edema. Some are secondary of the kidney, some are because of the liver. And you said why you have enlarged heart, and that enlarged heart really coupled the misery of having edema. So little by little, you have the doctor should decrease the amount or the volume that you have in your body, little by little. Because in my management of these cases, I have to see the patient every day,
Correct.
even in a messenger video call. I have to follow him up. Are you taking your medicine? You have to limit your fluids, because the fluids that you are already in your body, your heart will further increase the size, and the more you
Okay.
will be in a miserable situation.
Wow. Okay. So the one who inquired about the heart enlargement, you have to really go back to your doctor. You have to be
Yes,
managed closely. This is what
that's it.
Doctora said. And while she's recommending the triangle of health, it will be good to let your doctor know about what we have, so he can incorporate it in the management, diba, of
Yes,
this patient.
Mommy
Okay.
Kate, Mommy
Yes,
Kate.
Doctora. Yes, go ahead.
As a warning or a piece of advice, when there are doctors that will not accept our products. Based on our experience, there are
Yes.
doctors that I'm sorry to say for the doctors who are in the call, because some of these doctors, I should say most of the doctors, we are only 10% who believes in this and examine and have any studies or have research of these products. And if they do the same thing, they will incorporate this in their management to their patients. But sad to say, some of the patients, if they will talk to their doctors, the doctors will immediately say stop that,
Yeah, I know.
because they do not know
I know.
any
I
products.
understand. I understand
Mm,
perfectly. Yeah,
yeah.
and that is so true. It is so
Yes.
possible. Okay. Doctora, let's go to Raquel de la Serna. Can I just ask everyone who's typing in the chat to please revert to the Q&A for those who have questions, no? Pero kung mga comments lang, okay na yun. Kasi I saw something about a lady dropping the nitro extreme in her eyes. I think that's too strong,
Strong.
'di ba? The most that we do is put the FX,
The
right,
effects.
Doctora? Oo, the
But
FX.
but uh,
Okay. Yeah. Yes,
but if
proceed,
you
Doctora.
but if you will use the extreme, I have one patient, the 84-year-old patient. She used to extreme rather than the effects.
She likes
because
that
because he
one.
likes the yeah, she likes the extreme. But it is really a very very it it hurts. It really hurts, but it has nothing to do bad effect. But
Okay.
the more safer one, you have to use the Nitro FX.
Yeah, and still before you even use it, consult your doctor.
Consult your doctor.
Yes, please
What is-
consult your doctor.
Please, please, please.
Yeah. Can Kayani products help a patient who's already experiencing stage 4 cancer, has undergone 2 chemo sessions, already stopped chemo, siguro nasaktan na siya, no? Is experiencing pain in her legs and hips, no? And already has medicines for pain. Yeah, you already answered this, eh?
Yes.
Because
yes,
the Kayani will restore the nutrients our body needs, right, Doc?
yes, yes.
Okay. All right. This is a cute response, Doc, because Olaotse Gabasiane said that they're happy. The 2 nieces niya are happy taking the Kayani products and they're showing remarkable improvement. The challenge is the parents are retirees and it's hard for them to replenish their Kayani supply. Now, this is interesting. If the parents are retirees, it will be good for the parents to do the Kayani business.
Yeah.
So they can grow the money to buy their
Yes.
products for themselves. That's
Yes.
the beauty of Kayani, no?
Yeah.
All right. Oh, Teofilo Ayon, Doctora, can Kayani still help a patient who's been comatose already for 4 years? Wow,
No.
I don't know. Do you have any comatose patient? May kaso ka na bang ganyan?
Not I, but the Kayani friend also from GeForce. Because when they saw a patient, one with the loss of consciousness, and immediately they put under the tongue the nitro.
Yes.
It was in the church happened, and then she improved, and then went to the hospital, brought the patient to the hospital. She improves, and one with the I could recommend also this Kayani Nitro products to the comatose patient, since if especially if the patient is on NGT or nasogastric tubings, they can easily put through the nasogastric tubings the Kayani products.
So that's how they give it to the
how they give
patient.
it to the patient.
Yeah, yeah.
Yeah.
Okay. Doctora, there's a Spidey. Baka ano to, kamag-anak ni Spider-Man, no? Sabi niya, how about goiter? Can the Kayani products help patients suffering from goiter?
Yes, the same thing with the other illness. You could combine this together with the management of the doctor, or you may use this without telling your doctor that you are using our Kayani products. You may combine. You may these are the food of our body. These are the best food that you could eat and give your body energy and the right to adjust your body into a good and normal one. That's
Okay.
what I could say.
Yes, thank you, Doc. Oh, there's an interesting question from Rubilin. What if the doctor says stop taking Kayani? Ako mo lang sasagot, ha? You know, Rubilin, if you have faith in your doctor, you follow him. Ako yun ang sasabihin ko. He has his reason for telling you to do it, no? But, you know, and then on another point, your health is in your hands, eh. Diba? I will ask for a second opinion. Or I will explain why will you ask me to stop taking Kayani? Sabi nga ni Dr. Torreja, this is functional food. This is the best food, diba?
Yeah.
Our body needs. And then it will help nourish us. No? So it's really up to you how you want to ano. Doktora, ikaw, anong sagot mo dyan?
Ako po. Don't follow your doctor.
You are so cute. Oo. Don't follow your doctor. Okay.
Mami, can I add one
Yes,
little
yes.
thing?
Yes, please, Doctora.
Imagine. These are the food. We are telling these are the food. In one Kayani sunrise, the equivalent nutrient is equivalent nutrient to an 8 apples. As if you eight apples.
Yes,
So we cannot eat one apple. You cannot eat one or two apple in one sitting. Just take kayani sunrise.
correct,
So these are
correct.
the food. These are the food.
Yeah, talagang the best food, 'di ba? Okay, Doktora, I'm just curious, no? We're trying to answer a lot of questions here, eh. Pero naisip ko lang, no? A thought just occurred to me. We're talking about people here who have medical conditions, okay? What about for people who are healthy naman, 'di ba? And then they will tell you, "Oh, Doktora, I don't need your kayani because I'm not sick." 'Di ba? I'm healthy. Wala akong nararamdaman in my body. How will you answer that, Doktora?
First question, how old are you?
Kunyari, kagaya ni Mami Kate, 65. Oh, sige. Ano
Okay.
ang sagot mo dyan?
If you are healthy, your blood vessels are not healthy. Definitely 100%. Your blood vessels is not healthy
Because
Why?
of the age.
because
Yeah.
of the age. Only 15% production left in your body. Sooner or later, your blood vessels will thicken, and your aorta from the
Oh.
heart is second already. That's why we have atherosclerosis aorta in the chest X-ray results, mostly in our
Yeah.
elderly patients or elderly individuals.
Wow. Doktora, what if the patient tells you, Doktora, I'm 30 years old. I'm young. Oh,
Mm-mm.
anong sagot